So I'm very excited for the future because the data that has been presented today at ASCO and yesterday and that will be presented tomorrow, it's all changing the way that we manage our patients with CLL or with lymphoma. It's amazing the advances that we have seen over the last 3 or 4 years where we're doing targeted therapies, meaning that these drugs essentially target what is wrong in your cancer without affecting the other cell lines or the other components in your body that are keeping you healthy. So you are essentially having or being able to go back to do all your activities of daily living and feel like a human being as if you never had the cancer diagnosis. So people can essentially say, I feel the way that I felt before I had cancer. And this is something that I hear over and over again on my patients that are treated with these new agents. And so it's so exciting and reassuring for me that it's something, even though you have cancer, now you're not only a survivor, you're also back to being a regular person. And you can forget that you have a cancer diagnosis, even though it's still with you, because the cancer is in remission. At least, there are therapies that don't remind you that you have cancer. When you get chemotherapy, you look at the mirror and you have lost all your hair. So you essentially are reminded every day that you have cancer. With these new drugs, you essentially feel back to normal without any of the toxicities that we see with chemotherapy. So that's exciting news. And I think that the future is only getting better every day because of all the research that we have and all the technologies that we didn't have available years ago. So it's a very exciting time for us in oncology. And I can only, all my medical students and my fellows, I tell them, this is the right time to be in oncology. The field is exploding.